In this example, the SARS-CoV-2 virus enters through the nose. There, it attempts to penetrate our cells so that it can use them as a space to reproduce itself. To do that, it uses this spike protein to bind to what are called ACE2 receptors. The ACE2 receptors are damaged as the virus enters the cell and reproduces repeatedly, rupturing the cell, which is why the patient may lose their sense of taste and smell. The infection can spread down into the lungs, causing a dry cough and, in some people, shortness of breath. The next stage is the most serious. The infection can enter the blood vessels, and this is particularly dangerous for older people and anyone with cardiovascular problems, because they tend to have far more ACE2 receptors on the endothelial cells that form their blood vessel walls. So the virus has many more opportunities to attack. The damage to the ACE2 receptors causes the endothelial cells to release some remarkable entities called the Weber Palade bodies, which contains two key molecules, von Willebrand factor and the angiopoietin 2. In a healthy person, the von Willebrand factor forms local clots, which help us to stop the bleeding when we cut ourselves. But in COVID patients, clotting occurs throughout the body. As for angiopoietin 2, it damages the wall of the endothelial cells, causing them to leak and fill the lungs with fluid, suffocating patients in what's called acute respiratory distress syndrome. Spironolactone blocks the release of the Weber Palade bodies, and Sir Christopher strongly suspects that when spironolactone is combined with dexamethasone, the synergistic effects will prove remarkable and should save lives. Well, thanks for watching our program. If you liked it, please give it a thumbs up, share it with your friends and family, and even subscribe.